Hi, I'm Jim Brett, President and CEO of the New England Council. Thanks for tuning in to this month's episode of Inside the Corner Office, where we catch up with the leaders of some of our region's most well-respected businesses and organizations to learn more about their career paths and about the institutions they lead. This month, I'm thrilled to be joined by Matt Stone, the Executive Director of Youth Villages, New England. Youth Villages is a national organization that supports children and young people who face a wide range of emotional, mental, and behavioral problems. Here in New England, Youth Villages supports thousands of children and families here in Massachusetts, Maine, New Hampshire, and Rhode Island. We'll hear from Matt about the organization's incredible growth under his leadership and some of the services that they provide throughout the region. We'll also talk about how federal policy can best support this vital work. As always, I thank you for tuning in, and I hope you enjoy the conversation. You know, Matt, thanks for joining me. And we always like to start these conversations learning more about our guests and what drives them. So let's start right there. Tell us how you got inspired to pursue a career in social work and human services.
Thank you. Thank you, Jim. And thanks for all you do. And thanks to everybody at the New England Council. We appreciate the great work that the council does day in and day out and has for so many years. So really appreciate the opportunity to talk about myself and talk about Youth Villages, New England. So personally, I grew up in Memphis, Tennessee, which is where Youth Villages is headquartered. I actually got my undergraduate degree in psychology, and I didn't know what I wanted to do, honestly. I was playing music. I'm a musician, playing guitar and playing piano and singing. And I was waiting tables and actually working in a restaurant. And, it got to a point where it was time to start a career. I was having a lot of fun. It was time to start a career. And my father had been a fundraiser my entire life. He had worked at different hospitals across the Memphis Mid-South area. So he had been raising money for these hospitals for many years. And eventually he actually came to work for Youth Villages. His name was Marler Stone. And my dad, Marler, came to work for Youth Villages and started raising money for our organization. So I think he came to Youth Villages probably mid-1990s. And he had a wonderful experience working at Youth Villages. And, he knew I was thinking about starting a career. And he kept saying, Matt, you're good with kids. You enjoy working with kids and young people. And he knew that because I also, I grew up in a theater background. My father was an actor and a director, and I grew up doing plays and musicals and really enjoyed, I was just raised sort of in that theater environment. And there were 4 summers where I actually taught drama and music to children and adolescents at one of the professional theaters in the Memphis area. So I knew I liked working with kids. I really enjoyed helping young people and working with them. And Dad kept mentioning Youth Villages, but of course he's my dad. And I was like, I don't know about that. But then one day I got serious about starting a career. I left my bartending shift kind of late, and I ended up going to a job fair at the University of Memphis, where I had gotten my undergraduate degree. And the only booth that was still set up at this job fair, I got there late. The only booth that was still set up was Youth Villages. And it was kind of a sign. And so I came to work for Youth Villages in our residential programs. But that's how I got my start at Youth Villages. And then the rest is kind of history.
That's an interesting story, to say the least. And now you've been with Youth Villages for 25 years. Tell us a little more about this national organization's first office here in New England, and how did it come about, and what was that like in the early days?
Sure. Well, I actually first came to Youth Villages from Memphis, Memphis to bring Youth Villages to New England to support my wife's career path, whom I actually met at Youth Villages. And she went on to work on her PhD in psychology. And she had to do an internship. And we had hoped that she would get her internship at Vanderbilt because I was managing the group home programs for Youth Villages, group homes for children and adolescents across Tennessee. But then she did an interview at Brown University for an internship opportunity at Brown. and it was a wonderful opportunity for her. And so I knew that we had had our eye on starting up in new states, and I asked our leadership team at the time, and I said, can I be the one to start us up in New England, in Massachusetts? So that's what brought me to New England in the first place. And to be honest, like our first office was literally no more than a phone and a desk. And we had some temporary space in Lawrence, Massachusetts. And we were asked to come to Massachusetts by the DSS, Department of Social Services, Child Welfare. We were asked to come, to expand into Massachusetts. And they kind of aimed us at the northeast part of the state. And so, I literally had a desk and a phone, and we then when it was time to pick a permanent office, I remember sitting at my kitchen table and thinking, okay, all the work we do is out in the communities. What is a great place in the Northeast to have our first office? And I noticed that right in Woburn, 93 and 95 intersect, and that's a really good, convenient way for our staff to get on and off out in the community. So that's how we chose our first office in Woburn. And we had just a wonderful, very, very challenging startup as we got things going. I'll never forget one of the very first families we worked with it was a referral through the Department of Children and Families. It was a single mom, and she was the mother of 5 children.
She was from Haverhill.
Haverhill, that's right. Yeah, in Haverhill. And she had a 15-year-old, 14-year-old, 2 5-year-old twins, and a 2-year-old, and all these children they were struggling in their home. The children's father had passed away a year before, and all these kids were actually on track to end up in foster care. And if you looked at this family on paper, it just looked like they were falling apart. And previous services had failed. These children seemed destined to end up, in foster care and taken away from each other and from their mom. But we got in there and we started working really intensively with them. We did therapy sessions multiple times a week. We were on call every day, every night. We did early mornings, middle of the night, crisis support. And we did sessions in their home, sessions in their school. But over time, we were able to really support this mom and wrap support of family support around them so that by the end of our work, full custody had been returned to this mom. And we had prevented these children from being separated and being placed in foster care. And so, we really successfully helped this family that so many other people had felt like it was inevitable that these children just needed to be in foster care. So as we've continued to grow throughout the Commonwealth, we've been able to demonstrate the effectiveness of our Intercept and LifeSet programs, which I'll talk about. And we expanded into New Hampshire in 2010. And then about 3 years ago, we expanded into Maine and more recently into Rhode Island. So we've had a wonderful experience, growing this organization and supporting systems of care in New England.
I mean, it's an extraordinary story, and the growth is really, needless to say, very impressive. The footprint throughout New England, knowing that it started with the phone and and a desk, and all of a sudden the footprint has just grown and grown here. So it's great. It's a great story. Should be very proud of it. But people who are tuning in may not be familiar with youth villages. Just tell us a little more about the services and the organization that provides, the services for the children and the families in our region, and how you work with the different state agencies.
Yeah, happy to talk about that. I mean, we wouldn't be able to do the work we do without, the administration, without the Department of Children and Families in Massachusetts, the Department of Mental Health. And we've worked, carefully and closely with members of the legislature over the years. And I would say, since 2007, since we launched in New England, we've served nearly 17,000 young people in Massachusetts, New Hampshire, Maine, and Rhode Island. And these are very, very intensive services. So, that number, when you think about 17,000, that's a large number, but these are also very intensive services. And to support the staff that do that work, we've actually opened 8 offices across New England in again, Massachusetts, Maine, New Hampshire, and Rhode Island. We have about 365 employees. and they work every day with the state
Mm.
agency staff, that are out there working on the state end to support young people and families. So we've been, extremely excited and grateful for the work of the Commonwealth and all of the staff that work in those state agencies. Um, and I know I do think one of our greatest strengths, since we launched, in addition to the outcomes that we've been achieving for young people and families, has been the philanthropy that we've been able to bring to the table, and the fundraising that we've been able to do. And so, actually, over the past 4 years, Youth Villages New England has actually raised over $15 million to help young adults who are aging out of foster care through our LifeSet program. And I'll talk a little bit more about
Mm.
LifeSet. And we're also very proud of our emergency department diversion program through our Intercept program, and we'll talk a little more about
Yep.
that as well.
Right.
Yeah.
But how has the demand for the services changed and evolved over the last several years?
Yeah, I mean, I would say that we certainly, like most providers, saw an incredible spike in the need for services throughout the pandemic, behavioral health and mental health services.
Mm.
Um, the caseloads on the child welfare system and the children's behavioral health system, they go up and down, but
Hmm.
particularly during, periods of stress on communities and funding cuts and things like that, the services become much more needed. And the services we actually do, we have three programs, and I'll just briefly talk about each one of those. The first is Intercept, and our Intercept program, it's an evidence-based intensive in-home program, and it's really there to support children and their families, really children from birth to 18. And the goal of Intercept is to prevent them from entering out-of-home care or foster care or end up in a residential placement. Our goal is to prevent that and keep them safely home with their families, or to reunify them with their families as quickly as possible. If they have been in a residential program or a hospital or a group home. And so the staff in our Intercept program, they work with the child and the family, actually more so with the caregivers, to address the issues that are really impacting the stability of the family. We meet with them typically at least 3 times a week. We're also on call 24 hours a day. And, it's a trauma-informed model. So everything we do is is done in the context of being trauma-informed. So we're really excited about our Intercept program. The second program that we do is actually an adaptation of our Intercept model. In 2021, this goes back to what you were talking about, the increase in, the increase in need,
Yeah.
during the pandemic. Again, the need for, behavioral health, mental health services for young people just went through the roof. And we started partnering with the Massachusetts Department of Mental Health to adapt our Intercept model to be able to work with children who are at risk of becoming stuck in hospitals and pediatric boarding situations. And so we started doing that work. We've had incredible outcomes, very high rates of young people that we were able to completely prevent from needing to go in the hospital in the first place. And the outcomes for our Intercept model are very clear, and we measure a number of different things, but we do follow up research on every child we serve in Intercept, even 1 year post discharge. So even 1 year after the services have ended, we are collecting data to see how effective the programs were. And for Intercept, about 87% of the young people that we worked with in Intercept, they're still living at home even a year after the program ended, which really shows the effectiveness of Intercept. And the work that we've been doing with the hospitals to prevent children from being stuck in emergency departments has been just as effective. What we found is, after serving over 950 young people who were referred by 21 hospitals across the state over the last several years, what we found is that the vast majority of these children, they didn't need a bed in a facility or a hospital. What the family really needed was really intensive in-home support to help them manage the behavioral health, mental health situations that were going on with their children. So That's the intercept model. And then briefly, we have another evidence-based model called LifeSet. And LifeSet is a nationally recognized evidence-based service. And it's to support young people who are aging out of the foster care system or aging out of state custody in general. And, one of the challenges when we're talking about youth aging out of foster care or what we call transition age youth is that a lot of people don't even know it's a problem. But every year in Massachusetts, there are about 800 young people who age out, turn 18 and age out of foster care. And then if you add in all of the 19-year-olds, the 20-year-olds, the 21-year-olds, 22-year-olds, they're all in the process of this transition. So our LifeSet program, again, it's evidence-based, and it's been shown to be extremely effective at helping these young people make that transition successfully from being dependent on state agencies, in many cases for many years, bouncing around foster care systems to help them make that transition into independent living in adulthood. And it's a similar model to Intercept in the sense that the work we're doing is out in the community. It's out there where these young people live, in their communities, in the neighborhoods, where they work, where they go to school. We're on call 24 hours a day for these young people. So it's a similar in the sense that it's intensive community-based support, but it's also similar in the sense of very, very high rates of success. So even a year after the young adults have completed our LifeSet program, 89% of the young people that we've served, even a year after the program ended, they're still living successfully. They're working and or going to school. They haven't had any further legal system involvement. So really very successful programs with a high degree of efficacy that we've been so grateful to have the opportunity to bring to Massachusetts and New England.
Mm-hmm. Working with vulnerable children and families can be challenging, draining, emotionally taxing work. But I know, reading some of the background material to prepare for the program, you are very proud of the Youth Village's investment in staff in creating a very positive and healthy environment. Tell us more about that approach to building that environment and making the Youth Villages a great place to work.
Yeah. So, and this has been a priority for Youth Villages nationally, and it's something that we've also really deeply embraced here at Youth Villages New England. And I would just put it like this, about 7 or 8 years ago, we really started digging in on our engagement with our staff. And we had this goal in our mind that we've got to bring as much rigor to how we support and engage with and recognize and develop our staff. We've got to bring as much rigor to that employee engagement as we bring to the clinical work with the children and young people that we work with and the families that we work with. So, we put our heads together and we talked about, like, who do we want to be as an organization? What do we want our staff to believe about Youth Villages? And so we actually created a set of cultural beliefs. People matter, prioritize with purpose, trust, talk, and work together. And like, these are phrases that are new to you, but they're deeply meaningful phrases to us. Mm-hmm. And basically, these are the things we want our staff to believe about Youth Villages, that Youth Villages is a place where you can engage in transparent trust talk, where you can engage in, where people matter. And, we've done a lot to improve how we communicate and support and develop. So, it has produced amazing results for us in terms of, really helping us. This is hard work that we ask our staff to do. And, the very nature of the work and the challenges that young people and families experience, it is tough, but in every way possible, we want to make this job and make working with young people and families something that our staff can do for a career. And we've been very successful in reducing turnover, increasing retention of our staff, and really increasing like our scores on the Great Place to Work survey, which is a national survey. And all of our offices in New England consistently score in that range to be considered a great place to work. So I think it's, all of that culture work has really helped us, work with our staff, but ultimately it's about improving our outcomes for the young people and the families that we work with. Because when we have happier staff who are more seasoned, who are really we have fewer transitions of staff, that's better for children and that's better for families. So we've been really excited. And let me just say, like, it is tough work for sure, but it's something that we've really been able to make a difference in.
I mean, we hear that workforce shortage in the mental health, human service field is something that is just commonly mentioned as one of the biggest impediments in growing. Is that we can't find enough qualified people to go into this field. Just a very, very high turnover. What has your success been in this area?
Yeah. Yeah, and all of the things I was just talking about, don't get me wrong, it's still tough. Like every nonprofit out there, we've seen some challenges with hiring. We've seen some challenges with retention, but we've made a lot of strides to improve those things. We've improved the diversity of our staff across the Commonwealth as well. And we're very grateful that our staff retention has been strong overall. And again, I think this is in part due to the culture work and the organizational work that we've been doing, and the partnerships that we've been able to create with our staff. And our staff I get to do stuff like this, Jim, where I get to talk to folks like you. It's our staff and our leadership team that are really doing the hard work out there. And we are just trying to do everything we can to support them in that work. And they're truly making a difference, one session, one family at a time.
Mm-hmm. You've had an extraordinary period of growth here in New England. You got 4 out of the 6 states. You have a presence, a footprint. What's your vision?
We're not done either.
I know. Well, that was my softball question: is what is your vision for the organization in the next 5-10 years?
Yeah, we would love to, continue to expand within New England and reach other states, as we're needed. We want to go where we're wanted and where we're needed. I think looking ahead, we're focused on finding new ways to support, vulnerable children and families. And it is through strengthening our partnerships, across the 4 states that we're already in to really go deeper and be innovative and find ways that we can reach more young people. We want to help state systems and help state leaders, to improve outcomes for children and families. We want to help systems make systemic change that will result in better permanency for children and families and young adults. We do want to expand services that can safely prevent children from being removed from their homes and give them a better chance at long-term permanency. And we want to advocate for policy changes, both locally in the New England states and also at the federal level that are going to result in better services for children and families. So, we want to go deeper where we already are, influence policy, and yes, look for opportunities to expand to the other New England states that we haven't hit yet.
Shifting gears just to talk a little bit about the federal policy and what is going on in DC that's impacting youth villages in the community that you serve. I know that increased funding for the Chafee program is a top priority of yours, but for people who are not familiar, can you explain what this program is and why it's so important to you and your organization?
Yeah, absolutely. Yeah, as a national organization, we are deeply invested in what happens at the federal level, which has a major impact on our local operations in our states. And we're working to support funding and policies that will help us succeed and be able to reach more young people and families. And that includes strengthening supports and services for transition age youth. Again, young people who are aging out of state systems, who are going to be out on their own. And that's what the Chafee program focuses on. It helps young people who are in foster care or who have recently aged out of foster care to make a transition into adulthood. And Chafee, I think, is currently funded at about $143 million. And it is insufficient to meet the growing needs of transition age youth. And so that's one of our major policy objectives, is to increase funding for Chafee and then to be able to influence policies across the states so that extending foster care will be available to more young people who are transitioning out of care. through extension of foster care. And the Chase funds can help to be able to do that and help these transition age youth have better chances of success in that transition.
Mm. I know that another priority is the expansion of that emergency diversion and in-home services to prevent unnecessary out of home placement for children. Tell us a little more about that issue, but more importantly, is there any legislation pending that Youth Villages supports?
Yeah. So just to give you some context for the problem of pediatric boarding, just if you can imagine you're a parent or you're a caregiver of a young person, and that young person is experiencing some kind of mental health crisis, some kind of behavioral health crisis, and this might be, self-harming or suicidality or wanting to hurt other people, but a variety of different mental health, behavioral health crises. As a parent or a caregiver, you're terrified. What do you do and where do you go 24 hours a day to get help? Well, many families take their child to the emergency room at a hospital, emergency departments. And but that results in children becoming stuck in those hospitals because there have historically either not been enough beds to discharge them to from the hospital and like in a psychiatric placement, nor have there been enough community resources to be able to help stabilize those children at home safely. But as I mentioned earlier, we were asked at the height of the pandemic, we were asked by the Massachusetts Department of Mental Health to start using our intercept model to directly divert children from hospitalization and emergency department stays. And so over the years, we've developed relationships, I think it's 21, 22 hospitals across the Commonwealth, where within a matter of hours, we will respond to that hospital, do a very thorough assessment of what's happening with that child or that young person, and then get that child back home immediately with immediate safety interventions put in place, immediate treatment planning, and immediate support. And so again, I talked about that model has been so extremely successful in Massachusetts that it's actually become a model for a federal pilot. And this is it's called the Behavioral Health Emergency Room Boarding Diversion Pilot. But that pilot, that federal pilot, is modeled after our Massachusetts program. And we're just so excited to see that model that we've been able to establish in partnership with the Commonwealth, to now become what could be a blueprint to be scaled at the national level if it's fully implemented. So we've been thrilled to see that happen. There's also a separate hospital diversion pilot program, and it's also modeled after state, hospital diversion programs. So we're just grateful to be a part of that and to be able to demonstrate that so many young people who are experiencing a mental health crisis or a behavioral health situation, they don't automatically have to go into a bed in a hospital. They can be safely supported with very intensive in-home support. And we've been grateful to have the opportunity to demonstrate that. We're also grateful to the leadership of the Labor, Health, and Human Services Committees at the federal level, as well as Chairman Ederholt and Ranking Member DeLauro, have been incredibly supportive of this work. And so we're gonna keep pushing at that federal level to expand those pilots.
Last year's massive reconciliation bill, that so-called One Big Beautiful Bill Act, includes a number of provisions related to the Medicaid program. Can you share more about what you're seeing and hearing on the impact of the Medicaid cuts having on vulnerable children and families?
Sure. Yeah. I mean, I think, from my perspective, there are, really two priorities. First, there's a need, and it'll never be perfect, but there is a strong need for stronger interagency coordination at the federal level between child welfare and Medicaid systems to ensure children and families can access timely and appropriate services. So that's, something that we've really been trying to figure out. How do we help the federal system, which supports, state systems? How can we ensure that that interagency coordination is happening? So we've been very focused on that. And, secondly, we have been closely following Medicaid policy developments and system impacts. And the ongoing implementation of HR1, Medicaid provisions, and some of the proposed rules, for CMS, they could affect delivery of services. So we're trying to help support in any way we can. And I think it is true. There are recent reports that indicate that there are millions of children who have been disenrolled from Medicaid. And so we want to make sure that these young people are not falling through the cracks, and that they're connected with available proven services that are already in place in so many places. We just need to have that coordination to make sure that those young people get the support that they need.
Well, I just want to, thank you for taking the time to join me today and to share more about that incredible work that you and your dedicated and hardworking staff performs each and every day at youth villages. So our region, New England, is fortunate to have such an incredible organization as a resource for these children and families that are in need. So for those of you who are tuning in, I hope you found our discussion as informative and inspiring as I did. And be sure to tune in next month when our guest will be the CEO of Jamaica Plain Community Development Corporation, an organization on the front line, needless to say, of housing, and affordable housing, and the crisis that we face here in the region. And we thank you again for tuning in.